Good afternoon, everyone. My name is Fahad Shahid, and we are live from Prime Medical Centers and Prime Hospital and My Prime and on our YouTube channel with regards to a very, very special session that we are going to have today on insulin resistance, metabolic health, and diabetes. Talking about diabetes and all connected to it, as we are in the month of November, and we know that in November, World Diabetes Day is celebrated. That is on 14th of November. Uh, it's really very important to discuss on this. That's the reason we have Prime has this, arranged this session today. Insulin resistance, metabolic health, and diabetes. Let me just tell you about diabetes. It is marked every year on 14th November, the birthday of Sir Frederick Banting, who co-discovered insulin along with Charles Best in 1922. And since then, from 1991 onwards, we've been celebrating this World Diabetes Day to spread the awareness of diabetes. Why? Because about 422 million people worldwide have diabetes. About 1.6 million deaths are directly attributed to diabetes each year. In the long run, not controlling diabetes can damage important organs like the heart, kidneys, eyes, and nerves. This means that the heart disease and stroke, kidney disease, vision problems, and nerve problems can happen to people with diabetes. So it's really very important to know about this dangerous disease, and to control it is another very important part that we're really going to discuss today. Today with me, the guest speaker is Dr. Anil Kumar, who is consultant endocrinologist and diabetologist with an extensive experience of 24 years. For the last 15 years, he was in UK, and then from last 2 years, he's been practicing in Dubai in Prime Healthcare Group. His expertise are diabetes type 1 and type 2, gestational diabetes, thyroid disorders, and the list goes on. Doctor, thank you very much for giving us time. You're welcome to the webinar, Doctor.
Thanks for this opportunity for the Prime Healthcare Group. And basically, as Fahad was saying, diabetes is very common nowadays, and it's increasingly, the numbers are increasing worldwide. And so, as you were saying, 14th November is World Diabetes Day, but we celebrate whole month to get the awareness about diabetes. And thank you for joining this afternoon, especially with the difficult times. I know we are going through the toughest time of our lifetime, the pandemic of COVID. And I hope, as we all know, with across the globe, the numbers are increasing, or still the pandemic is happening. But UAE has done a remarkably good job, and the numbers are better here. On the so hope we get some vaccine, or the spread of the COVID stops in near future. That pandemic ends. But unfortunately, the diabetes mellitus is an epidemic. That means it's alarmingly increasing year by year. The numbers are increasing. So it's going to be for the long term. And as Fahad was saying, it's already 420 to 30 million with diabetes. More worrying is for me as a consultant endocrinologist is of the number are undiagnosed. That means that around 230 million people are in the community across the globe without being diagnosed having diabetes, even though they've got it, because they don't know, they're not being gone to the doctors, not being checked. And so that's more worrying as well, because these people already having developing the problems from the diabetes related issues. So before we even go about how do we manage diabetes, we need to know how to prevent it, the four most important things. That's what the topic for today is about, the insulin resistance and metabolic health and diabetes management. But before we head there, we need to look into the preventive measures. So in the event of World Diabetes Day, we need to understand, before even I go towards these things, I want to make it clear there are two major variants. There are other variants of diabetes, but for normal purpose, we need to know two types of diabetes. That is type 1 diabetes, where the body doesn't secrete any insulin at all. So these type of patient needs insulin all the time. So it is due to majority of the time from the autoimmune condition. That means that body is have got antibodies which is causing the problem. So it's nothing to do with the lifestyle changes, and they need insulin. And as World Diabetes Day is celebrated for the birth anniversary of Banting, who discovered insulin with Best and McLeod. Before that, diabetes was like a deathbed. So without insulin, people used to die. So then the treatment of insulin changed dramatically in 1922, and since then it's improved the care of diabetes. So type 1 diabetes needs insulin all the time. But for today's talk, we concentrate mainly about type 2 diabetes mellitus, which is, I can use the word, it's mainly to do with the lifestyle changes, majority of the time. And also there are a few other variants, but we'll talk about the majority, which is lifestyle changes, that is mainly insulin resistance. Okay, and also a lot of metabolic other risk factors which we'll discuss today. So what is insulin resistance means then? So insulin is being secreted in the body, but its working is ineffective. In sense, we got plenty of insulin, but that's not actually working basically because of overweight or obesity. So we need to know that. So what's the main issue here? So overweight and obesity. When does it start, or when do you start worrying about it? If you look at the amount of obesity across the globe, it's alarmingly increasing. It used to be around 5%, 10% around 50 years ago. Now, most of the countries have the obesity around more than 50%. So even if you look at the UAE data, so we got diabetes around 1.2, 1.3 million people have diabetes. Again, equal number of them are not being undiagnosed. We again, significant number of people are undiagnosed here, and also obesity is alarmingly increasing this part of the world. So none of the regions in the world is being saved from the obesity. So everywhere is a big problem. So there are again big issues about diagnosis of obesity, and so because if you look at the BMI criteria, it's mainly done with Caucasian population in health. So that means the normal weight is BMI less than 25, 25 to 30 is overweight, and more than 30 is obesity. But doesn't hold good for Asians. If you look at the WHO data, or a lot of studies, and also the IDF, the International Diabetes Federation, has agreed that for Asians, the BMI should be a little lesser. That means that normal BMI is only up to 23. So 18.5 to 23 of BMI is normal for Asians, especially Southeast Asians. And if you look at the overweight, it's from 23 to 27.5. And anybody with BMI more than 27.5 will be considered as obese for South Asians. So it's even lesser BMI compared to whatever the standard definitions of obesity across the globe. So not only about so if you look at a lot of people, even though they look slimmer, lot of, if you look at especially the males and even females as well nowadays, a lot of abdominal obesity is there. So again, that's what looking at the abdominal obesity, which is again the very high risk factor for a lot of metabolic complications as well. So not only about the overall overweight, even having abdominal obesity or having increased waist circumference is good enough to cause a lot of metabolic problems. So we'll discuss what are these metabolic problems. So initially, it starts with overweight or lifestyle problems, including overeating or lack of exercise, and then lead to obesity, and then it leads to insulin resistance, and then the pandorum of things for the complication starts. So including it can lead to diabetes mellitus, which is well known for all of us, obesity, but other crucial important things also we should understand. So we all know that heart disease also alarmingly increasing. So the insulin resistance and metabolic syndrome, what we call it as, give rise to a lot of heart problems, including heart attacks, that is myocardial infarction or simple angina, to strokes and also clots in the legs. So that's plenty of cardiovascular risk factors or risk, problems also happens. So we need to look into those as well. Not only those two factors, the other important things. I mean, I know we all know that a lot of young people are dying of heart disease. It's worrying. If you look at the stories, as a doctors we see in the hospital, but you can, as a even non-doctors as well, you see one of your extended family members or close friend. Suddenly they were well working in the office. Next day they died. Right. So this is worrying. So why it's happening? So because they've got the metabolic problems which is undiagnosed. So what are the metabolic other problems apart from insulin resistance? Look at the cholesterol health. So it may be cholesterol has got two components or three components in that matter. One is the good cholesterol, which is very important to protect heart problems. It can be low in people with insulin resistance or people with metabolic syndrome. Or the bad cholesterol, so it can be LDL or the total cholesterol is high. Another important thing is also called triglycerides can be high, which is causing the major issues. So apart from the diabetes and the cardiovascular problems, there are other things also can be affected from the obesity or insulin resistance. These include, it can, if you look at from the, I can use from top to toe as well. So it can cause a lot of stroke, dementia, and it can cause us issues with skin problems, including if you look at the people who got significant insulin resistance, they got a dark skin pigmentation in the neck and other parts of the body as well. And the liver can affect liver, causing what is called as a fatty liver to start off, and then it can progress to the scarring of the liver, causing cirrhosis or even the liver cancers as well. Using the word cancer, unfortunately, if you look at the insulin resistance, it also increases not only the cancer of the liver from fatty liver, it can also cause increases risk for colon cancers. And in females, it's very, one of the obesity itself is a big risk factors for endometrial cancer and the breast cancers as well. And both the groups, both male and females, the incidence of colon cancer has dramatically been increased with increase in obesity. So it's very scary to look at all these factors, but we don't realize all these things. So we always think that, okay, I'm fit, I'm going to the office or I'm doing my job. So even though people call it as healthy sometimes, I'll get worried if they say that, oh, he looks very healthy. It's unfortunately, for me, the other way around. When people are really overweight, it's not healthy. It's called metabolic. I can use the word metabolic time bomb they're sitting on. So all these underlying factors which I was describing. So we need to look into, so we need to focus on these factors. And alarmingly, I'm an adult endocrinologist. I look after adolescents to adults, but I know that a lot of my pediatric colleagues see obesity as an issue. And even, I mean, in general life, we see a lot of childhood obesity happening. And the insulin resistance can start from childhood nowadays. So previously, the definitions of diabetes used to happen type 2 above 40 years. When I was studying my medical school was in 90s, it was above 40s, it's type 2 diabetes. Then it came down to 30 years, it's called most common as type 2. Nowadays, I'm seeing in my own practice, a lot of people being diagnosed having diabetes mellitus in 20s. And more worryingly for me, I was seeing nowadays even 14 years, 13 years, 16 years coming with significant insulin resistance and even being diagnosed having type 2 diabetes. So it's worrying. I mean, they've got a long lifespan, right? So we need to prevent the complications as initially Fahad was introducing. Diabetes itself, when you manage well, they can have a normal life, okay? But when it's uncontrolled diabetes, that diabetes is not well controlled, then they can develop all the complications from, again, I can use the word from head to toe. So the most common complications are eye problems. It's commonest cause of blindness in the working adult group. That means a lot of adults develop blindness due to diabetes. And again, it's the commonest cause of chronic kidney disease or end-stage renal disease needing dialysis. So it's preventable if you have got a good control of diabetes. And other important thing is about the peripheral neuropathy or the issues with the feet, where a lot of people have amputations and their mobility is debilitated because of significant problems in the feet as well. So these are one type. The other important worrying is the cardiovascular. The MI is very significantly high in people with diabetes, insulin resistance. Again, the same with the stroke and the clots in the legs as well, that is peripheral vascular disease. So it's combination of both multi-organ problems when it's uncontrolled. So can it be managed well? Yes, we can have good control. And so there are two ways of looking at it. One, once it's being diagnosed, yes, we need to have very good control. It involves the mainstay of treatment is lifestyle changes, that is including both diet and the exercise regime. So even before we go into the medications, there are plenty of variety of medications which is helpful to, even to currently we've got medications to preserve the insulin secretions from the pancreas, medications to lose weight as well, medications to protect the heart as well. So the diabetes treatment has dramatically improved in last decade as well, actually. So there are plenty of studies which prove that all these complications can be prevented by having good diabetes control. So before we go more in details about medications, which you can discuss with your own doctor, but I would like to emphasize more on prevention of diabetes, that is how to manage insulin resistance even before it proceeds to pre-diabetes or diabetes. So I use the word insulin resistance even before pre-diabetes. Previously, we think that insulin resistance only diagnosed when people are having pre-diabetes or diabetes, but nowadays I realize even overweight people, even before the proper pre-diabetes, they're already developing insulin resistance just because of the overweight. So, and one more thing before we discuss of lifestyle, lot of myth going in the world saying that, okay, a lot of diabetes medications might cause kidney problems, other problems, but 99.9999% of all the complications from the kidney or the eyes, everything happens due to uncontrolled diabetes and definitely not due to medications. So that I can say rest assured. So let's focus on lifestyle changes. So what are we looking into these two things? So exercise, it should not be like okay, we'll do exercise as and required, so I'll go to gym once a week. It's not like that. You need to have at least majority of the days. So previously, it was at least 5 days. Now they say most of the days. That means that 6 or 7 days, you should have at least minimum of 30 minutes. But if you're doing simple walking, you need at least 1 hour, 45 minutes to 1 hour of exercise each day. And diet is equally important. It involves both ways of looking at it, including low-calorie diet or healthy diet involving plenty of fruits and vegetables. So on that note, I also want to make sure that one thing which is a lot of myth happening is, again, the fruit juice is good for health. Unfortunately not. Even the handmade, homemade juice is not good for healthy diet. So you can eat fruit as a whole fruit, but not as a fruit juice, even when people are overweight or obese. So another important thing is to have good amount of fiber, so at least have good amount of, say, fiber, having 30 grams per day is very helpful to have a good insulin risk management. So we can go into each diet, and always it's a good idea to consult when you're overweight, say a dietitian, or speak to one of us who practice diabetes. We can give you more ideas what's the best way. And so there are plenty of diets going around, including like intermittent fasting. It's well proven beyond doubt. It's very helpful. We know that there is medical data to prove that the intermittent fasting is helpful. So all this fasting is good. So previously there are a lot of myths that, oh, diabetes people can't fast. No, not exactly. So even it improves, the fasting improves the overall metabolic health of individual. So even the religious fasting, so maybe that's what the religious fastings is very helpful in long term as well. So you can do it. This is one thing which is can be used across all the religions. Every religion has got fasting, and even for who don't believe in religion, also they can fast as well. So this is one thing which can be done across population. So, and other way of looking at it is avoiding the processed food. So easily availability of lot of fast food nowadays, but I can't say we reached the age where the fast food is everywhere. I don't think we can be in a position to close everything, but having infrequent is the important thing. So we can't have treat every other day going to fast food. So yes, once in few weeks or once in few months, I think fast food is fine. But majority of the days we should follow a healthy diet. That's crucial here. So in nutshell, I can say that what are the major issues with insulin resistance? It's mainly to start off with obesity and overweight. And apart from what does it cause? What is the metabolic health involved? It involves the high sugars, it involves high cholesterols, and the blood pressure, and associated complications, which we discussed. What we need to look as a population is, a good example I can use the word is the Biofitness Challenge. It's very good initiative coming from the government. What we need to do is involving early in the fitness regimes, and this is a good encouragement to start off. So 10,000 steps each day. We need to follow it religiously, and then once we are used to it, then we'll find, oh, this is easy to be followed, and then we'll do it across the year. It's not about starting, then stopping, then wait for next year the Biofitness Challenge. No, but once we start that regime, then it's easy to maintain the 10,000 steps. We need to be committed for this. I mean, like we are committed to our work, we are committed to look after our children. If people are not working at home, yes, they're committed to look after their home. So, but also we need to committed towards looking after ourselves for the family purpose, and also for the world population purpose. Having that 10,000 steps or good physical activity of around even 30 minutes every day is important. Even doesn't matter. For example, I finished my work at 9 o'clock yesterday, but I didn't have the chance to do my steps. But I did it from, say, 10 o'clock to 11:55. I finished my 10,000 steps. That's it done. So we need to find sometimes. If I say that I'm tired or done work for 9 hours after patients, I can't do it. I won't do it. But when you want to do it, you can do it. Anybody can do it. And some people say, okay, I'm got arthritis, I can't even walk 3 steps. Yes, no problem. You do. There are a lot of videos in YouTube to say how you can do exercise sitting. You can do swimming, or you can just do exercise just by sitting. There are plenty of exercise, upper limb exercises. I don't think there is anybody who can't do some form of physical activity. Either you're a very fit person who can run, or person who is even bound to the bed or even to the chair. So you can do even the bed exercises for people who are in the bed bound. So I hope we all take this seriously, the epidemic of insulin resistance diabetes, and we all look for prevention of insulin resistant diabetes. And obviously, once you got diabetes, we are there to help you, and got medications to help. And once you got it, then again, don't put it in the back burner. Okay, I will try to avoid. So I don't want to take medication. There are a lot of myths saying that, oh, if I go on medications for life. Nothing like that. I got patients who are on 4 or 5 medications for diabetes, and once they've met me and tell them the importance of doing exercise, they change and they come to 0 medications and maintain without medication for even 6 months to 8 months already after even coming to UAE from last 2 years. So I've got plenty like examples like that in my own experience of 24 years. So making changes, we can come off medications. So if we suggest medication, please take it. Once well controlled, we can come off medication. So it's always about managing as a team. If you look at the World Diabetes States, the logo is the blue circle. That means that we are all together working. So it's we all together overall. So as a people who are getting the problems and the medical personnel, including the doctors, nurses, dietitians, allied specialties, plenty of other people who help in these, and also community educators and fitness trainers and all the people. So we all work as a team. We should all work together to for the betterment of prevention of these problems and to have a excellent outcome from this epidemic of diabetes. So even though the forecast has, we know that it can have 500 odd million people by 2030 have diabetes, but we all work now, we can prove that wrong, or we can reduce the incidence by becoming healthy.
Thank you so very much, Doctor, for this wonderful initial information that you have given. Doctor, one just request, if you can just put it on your feed. There are some people who would like to listen to you teaching. That should be fine.
Thank you.
Thank you very much, Doctor, once again. Doctor, you've really given a very detailed explanation on the topic that we are actually covering today. We've got a lot of questions coming in, actually. Before I move on to a question that came into my mind, I would like to ask the question that has come up from the audience side, I should say.
Yeah.
Dr. Ms. Rafia Rahil is asking, is DM2 and endometriosis related?
So endometriosis is not directly related to diabetes type 2, diabetes mellitus, but as I told you, endometrial cancers can occur from insulin resistance or type 2 diabetes mellitus or coming from obesity.
All right. Thank you, Doctor. Another question from Ms. Praveen. Mr. Praveen, I believe. Doctor, what vitamins are recommended for type 2 diabetes patients?
Okay, so see, for all of us, or even with diabetes, without diabetes, you need vitamins. And so for me, having a healthy lifestyle, having good amount of, say, if you look at the international recommendation, healthy foods, like having 5 portions of vegetables and fruits in your diet. So having good fiber is good enough to give good amount of vitamins. I don't recommend normally to have a supplements of vitamins, but obviously if the healthcare personnel make a diagnosis of having vitamin deficiency, especially sometimes people with diabetes can develop vitamin B12 deficiency, then definitely yes, the particular vitamin is needed. But regularly, the good diet is important.
Thank you, Doctor. Another question from Dr. Askia Nabi, and she's asking, is there any study where diabetes have been reversed?
Yes, absolutely, Dr. Askia, thanks for nice question, because as I was telling, my examples of a lot of patients come off medications, absolutely type 2 diabetes mellitus can be reversed, what we call it as a remission. So that means that people come off medications, and without medication they keep the HbA1c less than 6.5%, more than 6 months to 1 year, then we call it as definitely in remission or reversal of diabetes mellitus. Unfortunately, we can't call it as a cure for diabetes, because it's not like a cancer where you treat some cancer, it goes away. Diabetes, yes, it can be reversed with good lifestyle changes, but if you take your fed off, that means that you go back to your the bad lifestyle again, then it comes back with vengeance again. So in that sense, what we call it as a remission of diabetes mellitus. So you need to keep that lifestyle changes going throughout the life once you got diabetes.
Thank you, doctor. Miss Maria is asking, HbA1c test is enough to check if there are any inquiries to develop diabetes? If not, what are the other tests or measures we need to check in order to detect if there is a predisposition for diabetes?
Very good question. So HbA1c is one of the criteria to make a diagnosis of diabetes mellitus. So HbA1c more than 6.5% itself qualifies as diagnosis of diabetes mellitus. But if you look at the HbA1c from 5.7 and low is normal. So anywhere between 5.8 to 6.4% is called pre-diabetes. So other way of diagnosing diabetes is blood sugar itself. So having the fasting glucose and or the random blood glucose itself can make a diagnosis of blood glucose. So any blood sugar more than 100, what you call as the implied fasting glucose, that's the early indicator of pre-diabetes. Or if it's even the random blood sugars can be used as well. So other parameters, I mean, very good point that was. So when you're overweight or obese, you're looking, then obviously we need to look at the risk factors, and we look at the family history. Do you need to look into your cholesterol, and also looking at your exactly how much obesity you got as well.
Thank you. Another question coming in from Ms. Ilya Tariq. I'm currently 25 and BMI is in the essential range. Had a routine health checkup and my glucose fasting is 5.15. It's not high, but reference range mentioned is 3.89 to 5.6. And LDL cholesterol is also in the low risk range. Any comments on this? I don't have any other health issues and no family history even. You want me to repeat it?
That's no, it's fun. That's good to know that the way you describe, definitely you're not meeting any criteria for abnormal values, and I hope your BMI is less than 23. So if that's the case, considering you're 25, but this is the time to maintain the healthy lifestyle, because this is the age when people above, especially becoming 25, 30 years, and if even they put on mild weight gain, they're at high risk of developing, depending on again your family history, but right time to start doing healthy lifestyle changes.
Thank you, doctor. Mr. Praveen is asking, monitoring diabetes using freestyle device, how accurate it is?
Okay, so Freestyle Libre is it's a glucose sensor. So it's usually monitors blood glucose coming from the fluid in the fat tissues that is under the skin. It's very accurate, like any other glucometer. It's not as accurate as the lab glucose, but you can't go to lab to check blood sugar each day. So the glucometers were there for long, but a lot of studies been proven that Freestyle Libre readings are very, very matching with the glucometers, or even for that matter with the lab glucose. So it's very and it's being approved across the globe. Even it's approved for driving purpose in UK as well. So which has got one of the highest standards to check blood sugars. So I'm happy with the Freestyle Libre.
Thank you, doctor. Doctor, I've got a question from Dr. Jamil. Dr. Jamil is asking, Dr. Anil, I see that you are qualified from the UK. What's the difference in terms of treatment from there to here?
To be honest, there is no difference in using the medication or methods. Only the healthcare system is little different. Obviously, UK is 95% is NHS run, that's government run. So there is a lot of initiated in the GPs to look at the healthy lifestyle changes initially. And in UAE also, I mean, the healthcare is mainly the private healthcare driven, and so it is at the discretion of the doctors to suggestion of how the lifestyle changes involved. And but medication wise, definitely same medication is available in UK and here, and so the care is equally good across both the sides.
Thank you very much, Doctor. We've got another question coming in from Dr. Asya. The question says only high LDL around 140 in a male, 51 years old, with no family history. What's your advice on that?
So, I mean, if you look at any guidelines regarding the cholesterol management, again, we need to risk score them. So, risk score them according to their ethnicity. That's very crucial, because we can't use, just say, Birmingham risk score, because sometimes it's just only for Caucasians. So, there are plenty of risk scores. You can use it from Q risks to the American diabetes or the nice guidelines. There are all the risk scores, but use the risk scores which uses the ethnicity in particular. And then you look at other parameters as well. So I know LDL is the only abnormality, other things are normal, but we need to look into them. Are they smokers? Or they got the family history of MI? How they got diabetes mellitus? How they got even the impaired fasting glucose? And so it's about seeing that person as a whole, and calculating that risk score, and then advising. So any cholesterol above normal needs healthy lifestyles. So, but do they need medications or not depends on the risk score.
Thank you. I've got a question followed by the previous one. Dr. Asya herself only. Youngest age you have diagnosed with diabetes?
So, Dr. Asya, as I was telling, I'm adult endocrinologist. I used to see initially only 16 and above, and then the criteria is coming down to 13. So, I look after people only above 13 years, but I know people youngest being diagnosed even very early in the childhood. But I've been told even less than 10 years being diagnosed. But I myself diagnosed is 12 years.
Thank you. Just answering to one of our viewer, Ms. Rafia Rahil, your question was actually asked earlier to Doctor. I would request you to please, once the session is done, you can go back to you can reverse the video, and you can just see the answer related to the endometriosis and DM2 relationship that was asked to the doctor already. Thank you. Doctor, talking about, as we know, the topic today is about resistance. It's about insulin resistance, obviously. It's about metabolic health and diabetes. So I just wanted to know on metabolic side, Doctor, what is metabolic health and how it's important to achieve well-being?
So, as I was earlier telling, metabolic health involves a few significant components in it. So, for example, having a healthy lifestyle to maintain these parameters within range. That means the fasting glucose in the normal target, having cholesterol, especially the good cholesterol, above 40. So anything less than 40 is metabolic health risk, or we call it as use the word metabolic health or metabolic syndrome is a combination of things. So it means that having your good cholesterol above 40 or even having less than 40 is the metabolic risk, and having your triglycerides more than 150, and having your fasting glucose more than 100, or blood pressure more than 130/85. There again, if you look at what is exactly the normal variant, again, if you look at the International Diabetes Federation guidelines, WHO, each individual is each guideline is little different, and again the waist circumference is very crucial. And so if you look at the total recommendation was like people with this is American recommendation that waist circumference more than 40 is unhealthy for males, more than 37 for unhealthy for females. But if you look at the idea for Asians, and what they're saying nowadays, anything more than 90 centimeters, that means that even the waist more than 37 for males or more than 32 for females is unhealthy. So that's again a metabolic risk.
Right. And doctor, what we should be doing about it?
So we need to look at what are the metabolic risk factors again. As I was telling, as most of the Asians are high, ethnicity itself is at a high risk for metabolic parameters, and people with overweight, even from any age, at high risk. So we need to maintain that age. The healthy lifestyle from the beginning of childhood, actually. And other very important groups of people are there, like postmenopausal women. And so people decrease the physical activity sometimes, thinking they're old. So, but they are also very important. There is very high risk again. And the smokers, they need to look into parameters. And the people with polycystic ovaries, they're at high risk of getting metabolic syndrome. So again, we need to concentrate. So all the changes, we need to make lifestyle changes from beginning of childhood.
Right, thank you. Doctor, another part of our topic is insulin resistance. I just wanted you to just explain our audience what is insulin resistance, and I just want to also understand: should we say that it's the second name of pre-diabetes?
So insulin resistance, as I was telling at the beginning of talk, is the insulin being ineffective from overweight or obesity. That's the first stage of the problem. And so insulin resistance is the beginning of pre-diabetes and diabetes. So insulin resistance can start even before pre-diabetes, but it can then progress to, if it's not followed the lifestyle changes, to pre-diabetes, and pre-diabetes itself progress to diabetes. But the insulin resistance will not go away if you progress to diabetes. So it will persist from normal overweight persons to pre-diabetes to even in diabetes. So main management for type 2s nowadays, managing the insulin resistance, that means making them to lose weight by lifestyle changes or with the medications.
Thank you, Doctor. Dr. Dirar Abdullah has asked a question. Difference in terms of efficacy and controlling blood glucose between daily and weekly injections for treating diabetes, whether insulin or not insulin.
So thanks, Dr. Dirar. The importance of management about diabetes itself, again, if you are dealing only with the insulin resistance, what we need is medications to lose weight or improve the insulin sensitivity. So that can be weekly injections, as we are saying. There are 3 weekly injections, which is called GLP-1s. They are called GLP-1 is a gut hormone which acts on the body's own pancreas to secrete insulin. It also delays the gastric emptying. That means that the food transition is slow, so that the glucose absorption is slowly there. So there is no big rush of sugar. And also this GLP-1, the hormone acts on the satiety center to decrease the appetite. So these weekly injections help them to reduce the appetite and delay the glucose excursion, and also body insulin secretion is needed, secreted, so that the glucose is controlled. People lose weight. So significant number of people, I've got patients who have lost 15 kilograms by going on these injections as well. And sometimes we do need insulin, because we reach a stage where blood sugars are remarkably high, and then we combine the GLP-1s, that hormones, which injections with the insulin, either in a combination or separately. It can be used. GLP-1s, again, there is a daily injection as well. So I'll talk to my patient and see what they prefer, and also I'll explain the advantages of each medication. So because it's all about patient preferences. So many medications we can't give because of, say, if the kidney is not working appropriately, we can't give certain medications. And also, if there are medications which acts on the kidneys to lose extra glucose, the oral tablets. Especially these SGLT2s, which helps to lose weight as well. So they're also equally effective like injections.
Great, thank you, Doctor. Doctor, correlation of diabetes with fertility.
Fertility.
Yeah.
Okay, sorry. So very important. If you look at the obesity and the polycystic ovaries, they go significant hand in hand. So a lot of people with obesity struggle to get pregnant, basically because obesity itself increases risk of polycystic ovaries and then decreases the of ovulation. So we have seen remarkably by just losing weight, the fertility rate suddenly improves. Yes, very crucial to have a normal weight for fertility purpose.
Doctor, a question. Symptoms uh, for anyone to know that they are at risk of diabetes. And I would like to add another part to this question. And if there are symptoms and one is even gets diabetes and get it get it left unnoticed, what it can lead to.
Okay, so a very important, very good question as well. So symptoms again, type 2 is very tricky. So a lot of people don't even get the symptoms. That's what the I want to emphasize even before going to symptoms, that a lot of type 2s are asymptomatic. That's why I was saying, even though we got 430 million diagnosed with diabetes, another 230 are undiagnosed and roaming around without being diagnosed because they don't have symptoms. So when we got a risk factors, like as we discussed, our family history and overweight and being Asian, with overweight, we should checking the blood sugar even before symptoms. So when symptom starts, what are the symptoms? Commonest symptoms is from starting from just mild tiredness to significant, what you call osmotic symptom, that is increased thirst, feeling too thirsty, and frequency of urination being high. And also being more hungry. These are classical symptoms. But when the sugars are really high, then they can start losing weight. And also risk of infections can be high. So these are ones time definitely should check it immediately without doubt. And so next question is, so what happens if you don't diagnose it? Unfortunately, if you look at the data from plenty of studies, and also looking at our own my own practice, we know that by the time people are diagnosed, already a lot of people started developing the complication of diabetes. That is, mild eye changes are there, or already they developed the nerve damage. So the high sugars can start damaging even from well before even it's being diagnosed on diabetes. But once it's not controlled, they keep doing the damage. So multiple organs, as previously explained, can affect eyes, kidneys, heart, and nerves as well.
Thank you. Doctor, diabetes in brief and how to control the blood sugar levels. Some very crucial steps for everyone to know.
Okay. So I hope even from my talk today, so everybody takes that all of us with diabetes, without diabetes, including kids, we need physical activity each day. So either minimum of 30 minutes, if it's a aerobic type of exercise involved, or say 45 minutes to 1 hour if it's a slow walking involved. Most of the days, that means at least minimum 5 to 7 days a week is needed. So that's even without diabetes, or with diabetes definitely needed. So that's the first beginning. And then the diet, very crucial. So even before going towards diet, towards the medications, diet is very crucial. Again, you need to see what's the healthy food, involving a lot of fruits and vegetables, at least 5 portions a day, and going less on the processed food, avoiding the sugary drinks, including fruit juice, milkshakes, soft drinks. And avoiding, we all know that the more unhealthy, the more tasty, but avoiding the processed food is or keeping your, I can use the word treat days. So if you do every day, it's the cheat days. But if you're even do it occasionally as a treat days is good, but not most of the days. You should follow healthy and avoiding having more of an involving Mediterranean type of diet. That's what's Mediterranean diet involves more nuts, lean meat, fish and chicken rather than more often red meat. Avoiding red meat or reduce the frequency of red meat, involve more lean meat and including plenty of vegetables, salads. It's good amount of nuts and pulses is crucial.
Thank you very much, Dr. Anil. Today's live session was really, really very important regards to insulin resistance, metabolic health, and diabetes. Before we end up the session, I would like to inform all our audience that you can always call and book an appointment with Dr. Anil if you want to have a consultation with him. As I said earlier, Dr. Anil is consultant endocrinologist and diabetologist at Prime Hospital currently. The number is on the screen for Prime Healthcare, for Prime Hospital Contact Center. You can always book an appointment calling the number, and you can always visit Dr. Anil. If you have any questions from the audience side who are currently watching us, you're always welcome to send us an email at myprime@primehealth.ae, and we will come back to you getting a response from the doctor itself, and you will get a response from our side to your queries. Doctor, once again, thank you very much. You've discussed, I believe you've covered the whole topic on diabetes, on insulin resistance, the metabolic health. What we understand is that obviously there are some facts and there are some myths that you've cleared also. Then talking about the exercise that is very, very important for a person who's diabetic, and obviously there are so many other things that we really need to look into. And of course, we should have a monthly checkup for a person who is currently diabetic. Just wanted to tell you, doctor, also a lot of people were actually appraising the session. They really liked your session, the way you have given the information. Doctor, one last question should I take before we end the session, because I just got an audience. Somebody wants to know low calorie or no calorie sweeteners like Candrel or safe to take in diabetes?
Yeah, I mean, so sweetness again, it can be taken in diabetes mellitus patients. So I would suggest, okay, try with the sweetness first, and once you're used to that without sugar, then try to come off, because currently there is no major factors or worries from the sweetness, but on long term we don't know the disadvantages from using the sweetness. I would say I will always suggest go naturally, because once you're used to drinking your coffee, tea without the sugar, and maybe you can replace initially with the sweetness, and then try to come off it. And I've done plenty of my patients done it, and so I think it's easily doable as well.
Absolutely. Thank you very much, doctor. Moving towards the end of the session, I would like to thank all our audience who listened to doctor, and we would request everyone to spread this awareness among their relations, among their friends and family, so that every single person would be aware of this deadly disease. We will be coming back to you very soon with another live session, as we know that it is the diabetes month, but also we've got a prostate cancer awareness this month itself that we'll be coming back to you on very soon with another live session. So till then, saying this, Prime Medical Center, Prime Healthcare Group, I should say, we believe in personalized care personally, and that's what we deliver, and this is what our motto is. And we'll be coming back to you again. Thank you very much, everyone.
Thank you. Thank you.
Thank you, doctor.
Thank you.